my interest is, I work at the Veterans Hospital, which is a part of the group of hospitals at Indiana University. And my interest is mainly in non-invasive cardiology and diabetes and heart disease. And today's topic will be more focused on surgery or stenting in coronary artery disease for the management of severe atherosclerotic coronary artery disease. So why is diabetes important? As you know, that one of the diseases that is actually on the rise in the later parts of 20th century and 21st century is diabetes, and it has become an epidemic, and the US is the third largest country with the maximum number of diabetics after India and China. So it obviously is very important for practicing physicians to know about all the complications of diabetes and know how to manage them. And as you can see over here in the US, this is data from the American Diabetes Association. You can see the rapid increase in diabetes in millions over the last 15 to 20 years. And it is projected to increase for the next 20 to 30 years unless things change in the way people do their diet and exercise. And as you can see over here, it is projected that there will be 100 million diabetics by the year 2050 if the current trends in increase continue. And even if it doesn't, there'll be close to 75 million by 2050 in the United States.
This is just US?
Yeah, this is just US. So that's a lot of diabetics, and although it's good for doctors because it's job security, but for the people in general, it's not a good thing. And I say that partly facetiously, but the truth is that diabetes does give work for everybody, whether it is the kidney, the brain, the heart, everywhere, all the complications, it gives a lot of work for a lot of doctors. So the reasons are not far to see why diabetes is on the increase. As you can see that the diet in the American field is basically laden with calories, and all of these lead to glucose and obesity and metabolic syndrome, which ultimately culminates in the development of diabetes and its complications. And not only is the diet a problem, exercise is also a problem. Basically, there is a lack of exercise, so coupled with high calorie diet leads to metabolic syndrome and diabetes. And as you can see over here again from the American Diabetes Association, diabetes-related death certificates among people ages more than 65 years, 68% noted heart disease and 16% noted stroke. So cardiovascular complications remain one of the leading causes of death in patients with diabetes. And that's why it becomes important to know about the proper management of cardiovascular disease in diabetes. So a lot of it is important in preventing heart disease, but today's talk is not on prevention. But I don't want to underemphasize the importance of prevention to actually detect the risk factors and manage them effectively to prevent onset of significant heart disease. Now that's all the bad news. Is there any good news? And there is some good news. And as you can see over here, that effective management of heart disease has actually resulted in decrease in deaths from heart disease, both in non-diabetics and in diabetics. So as you can see over here, the incidence of myocardial infarction, stroke, all these things which are associated with major, arterial disease has decreased in the last 20 years. So that's the good news. But still, as diabetes increases, it looks like it's never going to reach the level of non-diabetics, and that's why we have to work harder. And this is one of the studies we looked at in the Veterans Affairs medical system. And this was published a few years ago. And as you can see over here, that post-myocardial infarction mortality was actually higher among diabetics compared to non-diabetics over a 7 or 8 year follow-up. So with that, we come to the main part of the presentation, which is how to manage severe atherosclerotic coronary artery disease. And this is a very common scenario seen by physicians, both general practitioners and in cardiology. So we start with a simple case. Mr. AF, an otherwise healthy male, has known diabetes for over 5 years, treated with oral agents. He undergoes stress testing for atypical chest pain and has a strongly positive stress test. Coronary angiography reveals 3-vessel coronary artery disease with normal LV function, and he prefers not to have open heart surgery if he can avoid it.
How old is Mr. AF?
Mr. AF is most of my patients are in the 60s. Yeah. So what is different about the angiographic findings in patients with diabetes and coronary artery disease? So diabetics typically have more diffuse and distal disease. Angiographically, they have small reference vessels. They more frequently have multi-vessel disease and left main disease. The collateral formation is not as good as in non-diabetics. There is greater incidence of thrombus formation because of higher incidence of platelet reactivity, and also post-procedures like stenting, there is a higher restenosis rate. So all these things lead to worse prognosis in patients with diabetes and coronary artery disease. So the question is, what would you prefer? Would you prefer open heart surgery or percutaneous coronary intervention with some of the newer advanced drug-eluting stents for multivessel coronary artery disease in diabetes? So there are a number of recent prospective randomized trials which have addressed this question. And before that, I just want to show you a nice meta-analysis done by Dr. Halatki from the Northwest over here in the US. And he looked at 10 randomized trials which compared coronary artery bypass surgery to stenting. And this was published in the Lancet. And as you can see over here, that if you have no diabetes, if you look in the bottom, right here, the curves overlap. So if you don't have diabetes, stenting is just as good as bypass surgery. But if you have diabetes, as you can see over there, that the mortality is much higher with stenting or PCI compared to bypass surgery. So this is the diabetics who get stenting over here, or PCI, and this is the diabetics who get cabbage. Okay, and this is no diabetes. Cabbage and PCI are the same. The slide on the right excludes one of the big studies called the Barry trial, just to make, because that had a huge number of patients, so they didn't want one study to bias the meta-analysis, so they actually did the analysis with just 9 trials, and again it shows the same thing, that if you don't have diabetes, then PCI or cabbage are the same, but if you have diabetes, then basically surgery is much better off. So these were some of the older trials, and this is just a meta-analysis. Now we come to 3 major trials that basically looked at revascularization with or without medical treatment, comparing stenting and bypass surgery. These were the Barry 2D, Freedom, and VA cards. So Barry 2D actually had a 2x2 design, and they had, as you can see, a large number of patients with type 2 disease and angiographic coronary artery disease, and they were basically divided into 4 groups, okay, in a 2x2 factorial design. So insulin sensitization and insulin provision, revascularization and with medical therapy or medical therapy alone. So patients who had angiography were initially divided into 2 groups, bypass surgery or stenting, and this was done by the doctor taking care of the patient depending upon what he thought was best for the patient at that time. And then once they were divided into bypass or stenting, they were again randomized to medical therapy versus cabbage or medical therapy versus stenting. And they were further randomized into insulin provision or insulin sensitization. Okay? So the initial randomization, it wasn't like a randomized thing, it was basically done at the discretion of the physician, but once they were classified into cabbage or PCI groups, then further it was all randomized. And the goals of medical therapy was to keep the HbA1c less than 7, LDL less than 100, and blood pressure less than 130/80. And as you can see over here, that between medical therapy and either PCI or cabbage, the two groups, there was no difference between medical therapy and revascularization at about 5 years of follow-up. Okay. But that's the overall total mortality, okay, all-cause death. But if you look at death, MI, and stroke for medical therapy versus type of revascularization, you can see that the cabbage group did better. Okay, revascularization was better. So although overall mortality does not change, but if you include the composite endpoint of death, MI, and stroke, cabbage does better. Okay. So if you have to do some kind of revascularization, it's better to do cabbage in diabetics. And if you look at the 2x2 factorial design, the group that did the best, that had the lowest event rate, was the group that got cabbage with insulin sensitization. Okay, so the glitazones are good drugs for decreasing coronary events. Okay, so that was the conclusion of this study, that overall the death was not different, but if you look at death plus MI plus stroke, the combined endpoint, then prompt cabbage was better than PCI with medical therapy. And the benefit was mainly because of decrease in MI rates, okay, not so much as death. So what they conclude is that patients with type 2 diabetes and evidence of extensive coronary artery disease, multivessel disease, may benefit from prompt bypass surgery and medical therapy. Okay? And patients with less extensive coronary disease, who are usually referred to PCI, they actually do not benefit mortality-wise or even death, MI plus stroke by stenting compared to just medical therapy. So if you have less extensive disease, this study shows that medical therapy is just as good as stenting. But if you have more extensive disease and you're considering revascularization, then cabbage is much better than PCI. So this was a study we did in the Veterans Affairs Medical Center called the Veterans Affairs Coronary Artery Revascularization in Diabetes Study. This was done exclusively in the US, and this basically looked at patients who had severe multivessel coronary disease along with left anterior descending artery disease. Now, one of the issues was because this study was done totally in the US, we could not recruit the number of patients we wanted to, as it happens in patients, in clinical studies done exclusively in the US. But what was interesting is that even with the limited number of patients we got, we saw that survival was better with cabbage. So as you can see over here, the top blue line is cabbage and bottom line is PCI. So when you have multivessel disease, cabbage overall mortality is better with cabbage compared to PCI. The larger study is sponsored by the NIH. Our study was sponsored by the Veterans Affairs Department. The Freedom Trial was done by Dr. Fuster and colleagues in Mount Sinai, and this was sponsored by the NIH, and this was an international study, and 2/3 of the patients came from outside the US, so they were able to recruit all the patients they wanted. And patients with multivessel coronary disease were randomized to stent or surgery, And unlike our study, they used only one kind of stent, the paclitaxel, which was actually given free to patients who were randomized to stents by the company. And our study used more later, newer drug-eluting stents. Okay, but this study was adequately powered because they actually got the number of patients they intended to recruit. And the primary outcome was composite of death, MI, and stroke. And as you can see over here, the death, MI, and stroke was higher in the stenting group and lower in the cabbage group. 5-year event rates were 26% versus 18.7%. All-cause mortality was also higher for PCI, 16% versus close to 11% with cabbage, which was statistically significant. And the conclusion was that in patients with diabetes and advanced coronary artery disease, coronary artery bypass surgery is better than PCI. MI and all-cause mortality were independently decreased, but there was a slight increase in stroke. And they did some sub-analysis looking at what's called the syntax score, which looks at the angiographic complexity of the coronary artery disease. And they didn't find any difference between low syntax score and high syntax score. So once you have multivessel disease, irrespective of what the syntax score is, cabbage is the preferred method of revascularization in patients with multivessel disease and diabetes. So just in summary, the prevalence of diabetes is increasing worldwide, and despite advances in therapy, prognosis continues to be worse for diabetics with coronary artery disease compared to non-diabetics. And long-term outcomes are better for cabbage or bypass surgery than PCI in diabetics who need revascularization. Insulin sensitization is better than insulin provision for long-term cardiac benefits. Thank you. That's the presentation. Any comments or, yeah, go ahead.
Yeah, I think should be another treatment group, and if I were a patient, I would say none of the above. I would prefer to try thyroid hormones. We do know from animal studies that the microvascular impairment appears to be due to low thyroid function at the cardiac